Hi, I'm Randy Walters, President of Partners in Exceptional Care. Welcome. I'm glad you're joining us this evening. I'm coming to you from this special InTouch cart that's used in our specialty clinic. This cart is what Dr. Webster uses to interact with her patients and nurses. Continue watching to learn more about Dr. Webster and the unique way we can provide world-class oncology services here at CRHC.
Good evening. I'm Chuck Nordic, CEO of Clarinda Regional Health Center. At tonight's Platinum Virtual event, we are highlighting the tremendous work of Dr. Webster, Sarah Lockman, our PA, and the oncology staff for all the work they're doing to advance exceptional care. Part of this care is our Infusion Center. We have just begun a major expansion and remodel project here at the hospital. The project impacts about 19,000 square feet here at the hospital to include a couple clinics, a new surgery suite, new pharmacy, and our Infusion and Oncology Center. Oncology is one of those departments where you require some long and arguably uncomfortable treatments, and one of them is infusions. Infusions can be sometimes 4 to 6 hours and oftentimes multiple days in a week. It's something that people unfortunately have to have during a time of their life where they're probably not feeling their best. And we want to do our part to make it the most comfortable experience possible. So something as simple as saying an infusion chair may not sound like a lot, but having a chair that has heat, that has vibration, that has automatic reclinability, has those little perks in them that a traditional chair would not have, can make all the difference in the world for these folks. And you know, if I'm someone who has to sit next to someone who's getting an infusion, I want to make sure that they're comfortable, and boy, I would really like them to have one of these type of chairs. So we think that our patients deserve the best, and that's what we're going for as far as an infusion chair.
Oh, fun. Okay. Well, I mean, it's not anything.
My name is Stacy. I'm a specialty clinic manager. As a specialty care manager, I work with a great group of individuals, from nurses to techs to doctors to administration to all the staff here at Clarinda Regional Health Center. And what we do every day is we put the patient at the center of every decision we make. At Clarinda Regional Health Center, the great thing is that we're able to provide chemo infusions for our patient. We have Dr. Webster, who joins us from Portland, Oregon via telehealth. She's an amazing oncologist. We also have Sarah Lockman, who is our PA. She's feet on the ground taking care of our patients. We have nurses who specialize in infusion. We not only give chemo infusions, but we give iron infusions. If somebody needs a special med for maybe their arthritis, we're able to give that too. If you see an oncologist at Omaha, we're very willing to coordinate the care with them, make that come together. Maybe you could have your scans here, your blood work drawn here. We can flush ports here. We are very willing to coordinate your cancer care and help you through that journey, no matter what it takes here at Clarinda Regional Health for us to provide exceptional care for our patients.
Thank you, Stacy, for sharing a little bit about your job and what the specialty clinic can provide for our patients. The specialty clinic has some wonderful team members that care very much about their patients. We want you to get to know them and learn more about how the funds raised tonight will benefit our team in providing care to our patients.
My name is Kendall Moore. I'm a specialty clinic RN at Clarinda Regional Health Center. The first thing that comes to my mind when I think about CRHC and the Infusion Center is it's a very welcoming place to work, and we have a great team here. I know anytime I come to work that all of my team members and I will work together to make sure our patients get the best care possible, and we work very hard to make sure that they are pleased and have a good outcome when they leave our clinic here. Some of the benefits about moving the Infusion Center to the new area, we're going to gain a little bit of space, which is something that we definitely need with our growing patient load. We will have windows. That's a huge thing that we would really like to talk about. Is we're kind of in a little hole right now in the hospital, so gaining windows for the patients to look out. It's going to be a really great thing. We are going to have private chemo bays with like dividers instead of just curtains, which I think will gain us a lot of privacy. We'll have offices for our oncologists, Dr. Webster and Sarah Lockman, and they'll be right there hands-on with us the entire time, anytime we're doing any type of infusion. I think it's very important for the community to be supportive of this expansion. It's great opportunities for anyone who's receiving any type of infusions, chemo treatment. It's close to home. They don't have to travel hours to go get treatment and then feel yucky coming home. We're taking care of patients at their most vulnerable states, and I think it's really awesome for us to have it close to home, you know, familiar faces, just a small community environment. I think it's going to be a great thing.
Hello, I'm Bailey Clupp, Manager of Volunteer Services and Committees. Among other things, a part of my role at CRHC is working closely with our newly combined foundation and auxiliary group, Partners in Exceptional Care. I manage the volunteers and committees that help our fundraising efforts that all goes back to support Clarinda Regional Health Center. We hope you enjoyed the meals provided at our drive-thru dinner. We would like to extend a sincere thank you to everyone who helped make this meal possible, including Hogstop Barbecue for the delicious meat and Robin's Nest Cafe and Bakery for the wonderful desserts. I'm so glad you're here tonight to help support Clarinda Regional Health Center and our new Oncology and Infusion Center. Raffle tickets are still up for grabs until 8 p.m. tonight, so please keep purchasing for your chance to win a 7 cubic foot Frigidaire freezer filled with a pork and beef bundle. Tickets are $5 for one or $20 for five. And now I am happy to introduce our Oncology PA, Sarah Lockman.
My name is Sarah Lockman and I'm a physician assistant. I work in the oncology department here in the specialty clinic. As a physician assistant, I make myself available for patients at all hours of the day. I'm here 5 days a week and I'm available through cell phone 7 days a week. And so I really pride myself on providing services for our patients whenever they need it. Cancer isn't something that's only Monday through Friday, and I realize that, so I try to make myself available for my patients. I'm helping to bridge the gap between our telemed provider in Oregon, but I'm someone who's here in person, and patients really appreciate that aspect of it too. So between the two of us, we really provide exceptional care for our patients.
Hello.
How are you doing, Tim?
Pretty good.
We serve patients all over Southwest Iowa who come to our center to receive services that normally they would have to travel to either Omaha or St. Joe. And so I know that being able to provide those services right here at home is a huge benefit for all of our patients.
Okay, my name is Judy Fastino. I would recommend Clarinda Regional Health to anybody. And I think it is very important to have rural health. If you have anything go wrong, you don't have to drive a long ways, you can come down here. I'll tell you what, I have been in several hospitals in Omaha and Council Bluffs, and I don't think any of them can hold a candle to Clarinda. The girls here are, I don't know what we do without them, let's just put it that way.
My name is Laurie Nordic, and I'm one of the nurses in the specialty clinic here at the Clarinda Regional Health Center. One of the ways that I help with the oncology part of the Infusion Center is I am a chemo nurse. You will not only take care of your patients, but that you also get to know their families, and that you also incorporate them into your care. The first thing that comes to mind when I think about having a hospital here in town, it's a wonderful way for patients to not have to travel a long ways away to get exceptional care. One of the benefits to moving our infusion center to the new location will be a larger space for us. It'll also be a more private area for our patients, so we can still give them the excellent care that they deserve. I feel that everybody should be willing to help support our new infusion center. Everybody has a family member, a friend, a loved one that has been touched by cancer. By helping with this project, it ensures that we also have future areas for the patients to be treated and continuing our great care.
The committee for this evening's event has been working hard to make sure you have an enjoyable experience as we come together to raise money for the Clarinda Regional Health Center's Infusion Center. The proceeds from this evening's event will be used to purchase new state-of-the-art infusion chairs for a more comfortable patient experience Please help us reach our goal by going to the link on the screen and selecting Make a Donation to give directly to the Infusion Center. Also, on the same site, you will find silent auction items that were so generously donated for this evening's event. And don't forget to purchase your raffle ticket for a chance to win a 7 cubic foot Frigidaire freezer with meat bundle with a value of over $600. Together, we can provide a more comfortable and satisfying patient experience for our friends, neighbors, and family.
And now let's hear from Dr. Devin Webster, our medical director for the Oncology Department.
Hi, I'm Dr. Devin Webster from Hematology Oncology at Clarinda Regional Health Center. Actually, I'm the director of Hematology and Oncology, and I've been here for about a year now. I started in May of 2020. And when I say here, I don't mean physically here in Iowa, because I'm not in Iowa. I'm actually in Portland, Oregon. So I'm talking to you about what I love about CRHC and why it's such a great place to get cancer care. I've worked in a lot of places over the years. I've worked in academic places, I've worked in private practices, and what I've loved the most is working in small rural towns and really bringing high-level cancer care to people who haven't had high-level cancer care. I will tell you that at Clarinda we have a fantastic team. They make the patient's experience with cancer much better, and they are really vital to a compassionate, community-centered, and excellent cancer care program. Taking care of cancer is not just about doing scans and giving chemotherapy and spitting out statistics. It's really about caring for people. It's really about seeing people with your heart and holding them with compassion and having the whole team be a part of that. And I think that's something we do so well. I feel so blessed to have connected with this incredible team. We have wonderful communication. I can count on Laurie and Kendall and Megan and Stacy and all the nurses to know exactly what's going on with my patients when they aren't getting chemo. And I can count on them to tell me what's going on when they are getting chemo. I can count on Sarah, my physician assistant, to help manage patients' symptoms, to help answer their questions, to bring them in when they need to be seen, and most of all, to just treat them with the kindness and respect and love they deserve as people going through a difficult time in life. Community support for this expansion project really feels like a big hug. It means that you care about the people in your community and you want to make their experience with cancer better. Cancer is so life-changing. I'm sure most of you know someone with cancer if you haven't experienced cancer yourself. It's one of the reasons I went into oncology, because I like being with people at those really crucial moments in their lives. I feel like I can make a difference, and I feel like our team can make a real difference.
My name is Chelsea. My experience here at CRHC in the Infusion Center has been great. I was pregnant when I was receiving all of my infusions. They were IVIGs. It was magnificent. The care was great. I always knew everything that was going on, and they never did anything without talking to my doctor. So it was great. It was very important to have a local hospital, so I didn't have to drive to Omaha for each infusion, because basically I'd get an infusion when my platelets would drop. So it was good that I didn't have to go to Omaha, and having something so close, I was able to come in on the weekends or after work. They accommodated my schedule very nicely. I would definitely recommend infusions here at CRHC. The doctors, I actually just now I'm seeing Dr. Webster. They are phenomenal. She is very in-depth, thorough. The nurses in there are great. They don't do anything if you feel uncomfortable. They will not do a darn thing. So it's been great.
So with this expansion project and new build that we're doing, we've been working on this for almost two and a half years. We've had a design for an oncology and infusion center that would be taking those patients into consideration and making sure that they got everything that they needed for that specialized care, to include a private waiting area, that they'll have a nice place to receive infusions where they have windows and they can look outside and whatnot. We felt in the beginning of this design that having it in the front of the hospital, where cardiopulmonary rehab is now, there's already tremendous light in there, would be a great location for this type of treatment. While we were designing the building, the surgery area and the shell-in space, it occurred to me that maybe switching this around and having the oncology center in the back of the hospital where you have actual views and be a little bit easier for parking, maybe a private entrance back there, would take our already great design and move it up a notch, maybe even expand it a little bit and make it a little bit bigger. So all the stuff that we've been showing, all the designs that we have been doing shows the oncology center in the front, and it's a tremendous design. But we have begun working on a new design that will actually lower the cost of the expansion project slightly, but be able to provide a better, I think, experience overall. And I'm really excited to see it once it gets fully developed, and we'll share that information once we get blueprints and such.
I believe that our job as cancer care providers is to meet people where they are, with information they can understand, at a level they can understand, to bring them the best possible care, the highest quality care that we can provide, and if we can't provide it here, to get them to a place where they can receive the best care in the world. Having a facility that embodies the caring and love and support of the community goes a long way in helping people heal and helping staff feel supported. You might not think a lot about what it's like to be a physician or a nurse or a physician assistant or a provider caring for patients with cancer. It's hard. We get attached to people, and we really love them. We really care about them, and we get to know them and their families. And so the support of the community, having money donated that goes to build a center that feels healing, not only for our patients, but for us. It feels like a place where we are supported in what we do, is just so special. And I really thank you for any donations you're able to give to this cause. Just know that it makes such a difference. You know, if you've sat in a chemo infusion chair, what it's like, and you know how important the environment is.
I would like to thank you all for joining us this evening for our event. With your generosity and support, we are making patient care at Clarinda Regional Health Center better.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.